Hi friends, good evening and welcome to my channel. Daily we are seeing exam based points and today's important point is normal laboratory values. So we can see the points. The percentage of blood in human body is 8%. That is, in total body weight 8% is blood and 92% is other fluids and tissues. Okay, the whole blood consists of 55% plasma and 45% formed element. Blood is in total body 8% is whole blood. That is blood. Blood consists of 55% plasma and 45% formed elements. This plasma contain proteins, water and other solutes. So proteins are 7%, water is 91% and other solutes are 2%. That is the plasma. And the plasma consists of proteins. So the proteins include proteins are 7%. Proteins include albumin, globulin, fibrinogen and prothrombin. Albumin is 54%, globulin 38%, fibrinogen 4% and prothrombin 1%. So plasma consists of proteins, water and other solutes. So water is 91%. Proteins we saw albumin, globulin and fibrinogen, and the other solutes are 2% that include iron, nutrients, waste product, gases and regulatory substances. These are the other solutes. They are 2%. And formed elements are 45%. Plasma 55% and formed elements 45% in whole blood. So plasma, the formed elements include platelets, leukocytes and erythrocytes. Normal platelet value we know 1.5 to 4 lakh per cubic millimeter, and leukocytes also we know 4.5 to 11,000 per cubic millimeter, and normal erythrocyte is 4 to 6.2 million per cubic millimeter. And these leukocytes include neutrophils 60 to 70%, lymphocytes 20 to 25%, monocytes 3 to 8%, eosinophils 2 to 4%, and basophils are 0.5 to 1%. These are the normal leukocytes count. So leukocytes is 4.5 to 11,000 per cubic millimeter. Some common abbreviations we can see. G bar DL means grams per deciliter. IU bar L means international units per liter. MCG bar DL means micrograms per deciliter. And MCG bar ML means micrograms per milliliter. MEQ bar L means milliequivalents per liter. Mg bar DL means milligrams per deciliter. And micro units bar ml means micro units per milliliter. Ml bar kg milliliter per kilogram. And mm cube means millimeter cubed. And mm per bar hour means millimeter per hour. Ng bar ml means nanogram per milliliter. Pg bar ml means picogram per milliliter. Units bar L means units per liter. Mu L means microliters. These are the some common abbreviations using in medication and normal values. Normal adult electrolyte values we can see. So sodium 135 to 145 milliequivalent per liter, and potassium 3.5 to 5.1 milliequivalent per liter, and chloride 98 to 107 milliequivalent per liter, and the bicarbonate normal value is 22 to 29 milliequivalent per liter. These are the normal adult serum electrolyte values. And next we can see coagulation studies. In that first we are seeing activated partial thromboplastin time, that is APTT. The normal value is 20 to 36 seconds. Mainly this activated partial thromboplastin test is used to monitor heparin therapy. During the time of heparin therapy, before heparin therapy we should check APTT test, and also this test is used for screening coagulation disorder, that is various bleeding disorder we can detect by using this APTT, activated partial thromboplastin time. Its normal value is 20 to 36 seconds. And if APTT value is prolonged, that is if the normal value is prolonged or longer than 90 seconds in a patient receiving IV heparin, initiate bleeding precautions. That is If the patient is receiving heparin therapy, we have to monitor the activated partial thromboplastin time. So if the value is prolonged, that is longer than 90 seconds, the client is at risk for bleeding. So we have to make bleeding precautions. And the next point, prothrombin time. In male adult, the prothrombin time normal is 9.6 to 11.8 second, and in female adult it is 9.5 to 11.3 second. And if the patient prothrombin value is longer than 30 second in a client receiving warfarin therapy, initiate bleeding precaution. So if the client is taking warfarin, so we have to see the prothrombin time. If it is longer than 30 second, we have to make bleeding precautions. Okay. And the next point, clotting time 8 to 15 minutes, and the bleeding time normal 1 to 9 minutes. And the platelet count, as we already saw, 1.5 to 4 lakhs per cubic millimeter, the normal platelet count. And the next point, monitor the platelet count closely in client receiving chemotherapy because of the risk of thrombocytopenia. Thrombocytopenia means decreased platelet count. So if the client is receiving chemotherapy, we have to closely monitor thrombocytopenia, and also we have to monitor WBC count during the time of chemotherapy. There is a chance of neutropenia. So in chemotherapy, we have to monitor thrombocytopenia and neutropenia. And the next point, erythrocyte sedimentation rate 0 to 30 mm per hour, normal erythrocyte sedimentation rate. And serum creatinine normal 0.6 to 1.3 milligram per deciliter. And the blood urea nitrogen normal values 8 to 25 milligram per deciliter. Next we can see normal adult blood component values. In hemoglobin, normal value is 114 to 16.5 gram per deciliter in male adult, and female adult it is 12 to 15 gram per deciliter. And the hematocrit in normal value in male adult 42 to 52 percentage, and in female adult 35 to 47 percentage. And the iron normal value in male adult it is 65 to 175 micrograms per deciliter, and female adult it is 50 to 170 micrograms per deciliter. And the red blood cells count in male adult is 4.5 to 6.2 million per mu-liter, and female adult it is 4.5 to 5 million per mu-liter. And next we will see normal adult serum enzyme and cardiac markers. So first we are seeing creatinine kinase. This is very important topic. So what is creatinine kinase test? Why it is performing? We can see this creatinine kinase test is performed to detect myocardial or skeletal muscles or central nerve system damage. So myocardium in heart, brain and muscle damage we can detect through CK, that is creatinine kinase test. And the creatinine kinase normal value is 26 to 174 units per liter. That is the normal value of creatinine kinase. And this creatinine kinase isoenzymes, the creatinine kinase isoenzymes include CKMB, CKMM, CKBB. Okay, and what is CKMB, CKMM and CKBB? We can see the isoenzyme CKMB is mainly found in cardiac muscles, and CKMM is mainly found in skeletal muscles, and CKBB is mainly found in brain. Okay, the isoenzyme CKMB in heart muscles and MM in skeletal muscles, BB in brain tissues. The normal value we can see CKMB, the normal value 0% to 5% of total, and MM it is 95 to 100% of total, and CKBB 0%, and lactate dehydrogenase normal value 140 to 280 units per liter. This lactate dehydrogenase is an Isoenzyme mainly affect myocardial infarction, that is normal value is 140 to 280 units per liter, and if the presence of lactate dehydrogenase in the blood sample is mainly helpful for diagnosing myocardial infarction, that is the value above normal indicate there is a myocardial infarction. So the isoenzyme, this lactate dehydrogenase isoenzymes include LDH1, LDH2, LDH3, LDH4 and LDH5. LDH1 it is value is 14 to 26 percentage, and 2 it is 29 to 39 percentage. LDH3 it is 20 to 26 percentage. 4 it is 8 to 16 percentage. 5 6 to 16 percentage. This is lactate dehydrogenase isoenzyme. And the next one important topic is troponin. It is an important area. Troponin is a regulatory protein found in striated muscle, that is mainly skeletal and cardiac muscles. And the increased amount of troponin are released into blood, that is in case of myocardial infarction. So troponin I, the value is usually lower than 0.6 nanogram per milliliter, and the value higher than 1.5 nanogram per milliliter indicate myocardial infarction. And same troponin T, the higher than value, that is 0.1 to 0.2 nanogram per milliliter is considered as myocardial infarction. Okay, troponin I and troponin T. It is mainly helpful for identifying the patient is having myocardial infarction. And next is myoglobin. Myoglobin is an oxygen binding protein. Troponin is a regulatory protein in cardiac and skeletal muscle. This myoglobin is a oxygen binding protein that is found in cardiac and skeletal muscles. And this myoglobin, its value is lower than 90 milligram per liter is normal, and if it is considered more than 90 milligram per liter indicate there is a myocardial infarction. Next one important topic is natriuretic peptide. That is natriuretic peptides are neuroendocrine peptides that are used to identify the client with congestive heart failure. There are three types of major peptides. First one is atrial natriuretic peptide, that is ANP, and is synthesized in cardiac atrial muscles, and its normal value is 22 to 27 picogram per liter. And second one, brain natriuretic peptide, that is BNP, and is synthesized in cardiac ventricle muscles, and its normal value is less than 100 picogram per milliliter. And third one is C-type natriuretic peptide, and is synthesized by endothelial cells, and its value is not yet determined. So these are the three natriuretic peptides mainly helpful for identifying the client with congestive cardiac failure. And if BNP is high in case of severe congestive cardiac failure, that is BNP is brain natriuretic peptide is high means if it is severe congestive cardiac failure. Bilirubin total, bilirubin direct, that is conjugated 0 to 0.3 milligram per deciliter normal, and bilirubin indirect, that is unconjugated 0.1 to 1 milligram per deciliter, and bilirubin total, the normal value is lower than 1.5 milligram per deciliter. And lipids normal value we can see serum cholesterol, it is 140 to 199 milligram per deciliter, and HDL, that is high density lipoprotein, it is 30 to 70 milligram per deciliter, and triglyceride lower than 200 milligram per deciliter. This is the normal lipid profile. And we can see normal blood glucose level. We can see in glucose fasting it is 70 to 110 milligram per deciliter, and glucose in capillary blood if it is taking 60 to 110 milligram per deciliter, and down it is glucose tolerant test, and glucose 2 hour postprandial it is less than 140 milligram per deciliter normal. And thyroid stimulating, that is thyrotropin 0.2 to 5.4 micro units per milliliter, and thyroxine T4 5 to 12 mcg per deciliter, and thyroxine free it is 0.8 to 2.4 nanogram per deciliter, and T3 80 to 230 nanogram per deciliter. And normal white blood cells count, neutrophils 1800 to 7800 cells per millimeter cube, and eosinophils 0 to 450 cells per millimeter cube, and basophil 0 to 200 cells per millimeter cube, and lymphocytes 1000 to 4800 cells per millimeter cube, and monocytes 0 to 800 cells per millimeter cube. Normal urine test values also here, that is urine color, pH and turbidity, everything it is normal values there, and also urine chloride, magnesium, potassium, sodium also their normal value we can see over here. And at the end I have given 5 important NCLEX based question also.